This talk on diabetes comes from the book Proof Positive, Chapter 8. Many newly diagnosed diabetics, as well as those who struggled with diabetes for longer periods, can control diabetes without drugs if they're willing to make some lifestyle changes. Here are the facts. Approximately 16 million Americans are diabetic. 50% of those are unaware. About 625,000 new cases are diagnosed every year, and this is growing. Over 6% of those 45 to 64 years old, and as many as 20% of those over 65 have diabetes. Total costs may be as high as $90 to $130 billion per year. How about the afflictions of diabetes? Life expectancy is shortened by 5 to 10 years or more. It contributes to 160,000 deaths each year, 2 to 12 times the risk for heart disease, 2 to 4 times the risk of stroke. Number one cause of blindness in adults, with 12,000 to 24,000 new cases annually. A factor in half of all foot and leg amputations, over 60,000 amputations yearly in diabetics. In any given year, over 50,000 diabetics are either on dialysis or have a kidney transplant due to diabetic neuropathy. Cause of peripheral neuropathy: an increased risk of breast and uterine cancers. There are two main types of diabetes, which is type 1, insulin dependent, and type 2, non-insulin dependent. It has been found that children who are not breastfed, or those who were breastfed and started on cow's milk earlier, have a greater risk of type 1 diabetes. This affects those who lose their ability to make adequate amounts of insulin, and without insulin they will die. The main fuel for the body is glucose. It can only get into each cell of the body if the insulin is present. Think of insulin as a key that opens the doors in the body cells so glucose can enter. If there is an insufficient amount of insulin, which is type 1 diabetes, or the so-called door locks are gummed up, so the insulin key has difficulty opening them, which can occur with insulin resistance in type 2 diabetes, the blood sugar levels can rise. When blood sugar levels rise sufficiently, the ability of the kidney to contain sugar is overwhelmed, and sugar comes out in the urine. The sugar takes water with it, thus leading to excessive urination, so familiar in uncontrolled diabetics. The loss of water results in another diabetes symptom, which is increased thirst. At the same time, sugar is not getting into the cells adequately, and the cells are starving for energy, resulting in fatigue, weight loss, and excessive hunger. Only about 5 to 10% fall into this type 1 diabetes category. The remainder have type 2 diabetes, which is generally caused by genetics or improper diet. Many type 2 diabetics generate enough insulin, but the body is resistant to it. This insulin resistance can be addressed by lifestyle changes, by maintaining proper exercise, diet, and achieving the ideal weight. Many type 2 diabetics can control their sugars. Some may need diet change plus a pill to control their blood sugars. Exercise plays a powerful role in lowering blood sugars, and evidence suggests that muscles in motion reduce resistance to insulin.